We're going to be celebrating 40 years since Professor Robert Jansen founded Sydney IVF, which was the forerunner to Genea. We were making transformative progress that was impacting not only Australia but offshore and around the world through the incubators we helped to develop and the culture media that eventually became Genea. I began as the immediate understudy to Robert Jansen, and then when he stepped back from clinical practice, I stepped up as the medical director, and that's when Genea came along. He had a tremendous vision about a combination of research, and he had an absolute commitment to excellence and patient care.
Sydney IVF became Genea. Now, they were always a benchmark for me because of his approach and his legacy. It's a tremendous honour to follow in those footsteps.
He's inspired me, and hopefully we can inspire doctors in the future to do the same. But it is all about continuing to do what he started. Rob Jansen taught me how to look after someone well and to get good success rates, but also to make them feel as if they have been looked after well.
Every patient who walks in the door is important, and you need to look after every individual. That 40-year legacy that Genea has is amazing as a framework for what we then build on moving forward to continue to provide every single patient with that gold level of care.
I think the new structure, Gavin coming on board, Mfunwi maintaining her significant role in our Medical Advisory Council, Mark in particularly the bringing on and educating and bringing through of new doctors, the future's looking very bright.
I have always been this kind of curious person, innovative, and wanting to produce the best for my patients. And Genea, without doubt, has wanted to be the best and produced a number of world-class innovations, which all the industry uses to this day.
As chair of the Medical Advisory Committee for Genea, patient advocacy is central to my role. The Medical Advisory Committee is there to make sure that when we're making changes and innovations that are important to success, they're also going to be things that patients can integrate into their lives and are suitable for them. So at Genea, we don't just measure success by how many babies we create. One of the key metrics at all of our sites is patient satisfaction. It's just as important for all of our clinics.
So my mantra is probably to treat others as you'd expect to be treated yourself. No, I don't want anyone to feel like a number. I want to lead by example, that people do the same. I think mentoring is teaching people not just about the medicine, but teaching people how to look after patients effectively and look after them well in the Genea way. So while there's innovation and change, it's important to maintain the standards, the level of care and the continuity, and hopefully will be passed on to those who follow on. And I think that's what leadership is about, teaching people to maintain those standards. That is one of the things that I value the most.
I would hope that over the next 40 years, Genea continues to provide not only that innovation and success rates for our patients, but also that individualised level of care that every patient hopes that they're going to enjoy when they come through an IVF clinic as a patient.
A legacy is so vital, not just as a thing of the past. It creates this immense basis. There's immense pride. And so it gives real strength to create our next legacies.
I think pride in Genea and the products that we have, the service we deliver, is one of the things that keeps driving me back to work all the time. I come to work because I enjoy it and because I'm proud of what we do.
I can't tell you what the next magical laboratory thing will be or when that will happen, but if it's going to happen at Genea.